variant continuing to drive some new daily record COVID numbers. Look here, more than 155,000 Americans are hospitalized with COVID-19. That leaves many hospitals short-staffed, and some now relying on National Guard members to help fill the gaps. Let's get some insights and expertise. Dr. Ali Raja is the Executive Vice Chair of the Department of Emergency Medicine at Massachusetts General Hospital. Doctor, grateful for your time today. One of the things we've talked about the last couple of days here in this program is in the big cities where Omicron hit first, some evidence perhaps were peaking and starting to come down. Yours is one of them. These are numbers from the Boston Department of Health. And if you look to the right of the screen, the Omicron surge not as high as it was, perhaps starting to tilt down a little bit, at least when you look at the average. That is potentially hopeful, but you're not seeing it in the emergency room and in the hospital yet. Is that right?
Not yet, John. We have 260 patients right now admitted with COVID to Mass General, and the numbers still look like this. We haven't seen that plateau yet. So unfortunately, while numbers might be plateauing for the city or the state, for the sick patients who end up in the hospital, we haven't seen that yet.
And so I'm from Boston, and so I pick up the Globe every day. I do it online now because of my distance. And I saw some pictures of protests outside the mayor's house the other day about her new vaccine mandate in Boston businesses. How do you, as a public health professional, I don't want to get you too deep into politics, but how do you try to break through with people in the sense that if you look at Omicron and you look at the data, that if you are vaccinated and if you are boosted, you are in so much better shape? That's true throughout once we've had vaccines, but especially with Omicron. And yet, look, this is the fully vaccinated percentage population in the United States. 2 months ago, it was 59%. 1 month ago, it was 61%. Now it's just 63%. It has barely budged up despite all the public data telling you this is the way to help yourself. If you look at the unvaccinated, 2 months ago was 26%, a month ago 23%, now it's 21%. And even among those who are vaccinated, and the government says get a booster, it will protect you against Omicron. 78 million people have received a booster, but that's about 40%. It's fewer than half of those eligible for boosters. How do you break through?
John, I think what we're going up against is that so much of the data is showing that Omicron is less severe than Delta and other variants. But what I try to remind my patients, especially those who come up and say, well, I'm going to have an Omicron party so that we all get Omicron now and just get it over with, is we know that COVID has long-term effects. And we know that we don't know all of them yet, and we know that there are going to be many more long-term. So if you can avoid it, we still need to avoid it. This is not something we should all just try to get over, and that's why we need vaccines and masks.
One of the conversations from the very beginning, when Trump was president, was why isn't there more and better and easier and affordable testing? Are we getting anywhere there now? The administration, the Biden administration, says it is trying now to ramp that up. Democrats today sending an urgent letter to the White House saying you're not doing it fast enough. Where are we?
We're not there yet. John, the fact is that it's great that President Biden is having insurance companies pay for and support people getting their own tests. But right now, getting tests is still exceptionally hard for my patients and just as importantly, for the healthcare staff who are trying to take care of them in the hospital. Even our own nurses and doctors can't find rapid tests to take. And so it's still very much a problem.
Dr. Raja, grateful for your time. We'll continue the conversation. Hopefully it gets better in the days ahead. Grateful to see you today, sir. Thank you. Republicans know immigration motivates their base. Now, a midterm year plan to ramp up attacks on Biden and the border. Some brand new CNN reporting next.